PQRST, different waves and types of changes in them related to different pathological conditions of your heart. Before moving to the P-wave abnormalities resulting due to different pathological condition of the heart, mainly related to the atria, we must have a little snapshot what we learned in the previous video. We must first acknowledge us about the three main things before jumping onto the P-wave abnormalities, that is ECG graph measurements. Second is leads. You may have listened about 12 lead ECG, 5 lead ECG. Here I'm going to talk about just 3 leads, first, second and third leads. And third is a one single question which you must answer before moving on to the P-wave abnormalities. Now talking about the ECG graph paper measurements, it contains two axes. First is a longitudinal axis which represents the amplitude, and second is the horizontal axis which represents the time interval. The longitudinal axis means the amplitude or the voltage. It is measured in millivolt because the electrical current produced by the heart that is too small that it can be measured in millivolts only. And second, the time interval, which is represented in milliseconds. So talking about the small boxes and the big boxes of the ECG. Small box of ECG is 1 mm in length and 1 mm in breadth. 1 mm in length means towards the amplitude or voltage size is equal to 0.1 millivolts, and 1 mm in breadth means towards the time interval side is equal to 40 milliseconds. And if you consider 5 small boxes towards the time interval axis, it will be 5 into 40 milliseconds means equal to 0.2 seconds. And on the vertical side, the 5 small boxes making a one large box is equal to 0.1 into 5 means equal to 0.5 millivolt. Now more about the leads.
What is 12 lead ECG? To know about 12 lead ECG, we must know what does lead mean. Lead refers to an imaginary line between two ECG electrodes. As we have discussed before, that there are 4 electrodes which are placed upon the limbs while doing ECG of the patient. So, what can be the lead between these 4 electrodes? First lead that is present between the right shoulder electrode and the left shoulder electrode. So this is an imaginary line. So this is named as first lead. Second lead which is present over here, that is between the right shoulder and the left leg. This can be named as second lead. And the third lead which is present in this diagram, that is between the left shoulder and the left leg. So this can be named as third lead. So this is first lead, second lead and third lead. Here we can see there is a triangle in between. This is known as Antovian triangle.
So here in the diagram, the arrowed part of the lead represents the positive terminal of the lead, and the another side of the lead represents the negative terminal. And the important point which should be noted down here, that if the direction of the depolarization wave of the heart is towards the positive terminal of the lead, it will produce a positive deviation and vice versa. And in case of repolarization, if the wave of repolarization is towards the positive terminal of that particular lead, then it will create a negative deviation
and vice versa.
Now with the third question, what does the ECG record? The ECG records the electrical activity of the heart, but it doesn't tell us anything about the pumping ability of the heart. ECG can tell us about the structural abnormalities of the heart, like hypertrophy of the heart chamber, dilatation of the heart chambers, conduction system abnormalities in the heart system, etc. Now let us understand it more by taking an example of the pulseless electrical activity of the heart. What does happen in that? When we see the ECG graph, we see the ECG waves, PQRST waves are shown. But when we check the pulses of the patient, we can't hear or we can't sense that because That time, the electrical impulses are produced in the heart, but the electrical impulses are not too strong to cause the contraction of the heart, maybe due to certain abnormalities in the heart. Now finally, with the P wave abnormalities, normally the amplitude of P wave is 2.5 mm on the vertical axis and the time interval is 0.06 seconds to 0.11 seconds. So as we know, the P wave represents the depolarization of atria. So any pathological condition related to atria will cause deflection in the P wave. Now considering the enlargement of atria, how it causes changes in the P wave. First with the pathological condition, that is P mitrale. Here the name denotes there is a mitral valve stenosis usually. Mitral valve is present between the left atrium and the left ventricle. When there is a stenosis of the mitral valve, the blood starts pooling in the left atrium only instead of going into the left ventricle. That causes hypertrophy or dilatation of the left atrium. So when there is a dilatation of the left atrium, we know the left atrium in the normal P wave represents this second hump over the P wave. But when there is a dilatation of the left atrium, this second hump, which is smaller in size as compared to the first hump, but here it will increase in size. Now considering the second condition, that is P pulmonale. So P pulmonale, it is a condition when there is a stenosis of the pulmonary valves. As we know, the pulmonary valve is present between the right ventricle and the pulmonary vessels. Because of stenosis of the pulmonary valve, the blood will start pooling into the right ventricle first. Then because of the backward pressure of the blood re-enter into the right atrium, and that will cause at last the dilatation or hypertrophy of the right atrium. That will cause this type of deflection in the P wave, and its size will also be greater than 0.25 millivolt. This type of the wave is known as bihumped bifid P wave. So this represents the enlargement of the left atrium, and this condition represents the enlargement of the right atrium. Now with another abnormality of the P wave, that is inverted P wave. It usually indicates that there is an ectopic atrial pacemaker present in the right atrium. What does ectopic atrial pacemaker means? As we know, the depolarization wave starts from the SA node, but in this case, the depolarization wave will not start from the SA node, it will start from the another tissue present in the right atrium. Next, what does this will cause? This will cause an extra heartbeat. Now moving on to the PR segment. So PR segment, which appears after the P wave. The normal PR interval, that is between 120 milliseconds to 200 milliseconds. If there is an increase or decrease in these intervals, it means that there is an abnormality in the heart. Now talking about the small PR interval means less than 120 milliseconds. Normally, the electrical impulses starts from the SA node, goes to the AV node and causes depolarization of the ventricle. But in this condition, that is WPWS, that represent the small interval. What does this mean, WPWS? It means Wolff-Parkinson-White syndrome. It is a type of arrhythmia. It is a condition in which there are extra electrical pathways in the heart by which the electrical impulses starting from the SA node, they travel through the extra electrical pathway and they depolarize the ventricles earlier than they should be. So what happens, there can be extra beat of the ventricles, means one atrial beat and two ventricle beats. So there is a characteristic wave on the ECG graph paper which we can see, that is delta wave. Delta wave is a part of early depolarization of the ventricles that may cause the ventricles to beat faster than the atria. Wolff-Parkinson syndrome is present at birth in children, but its symptoms appear within 11 to 50 years of age. Wolff-Parkinson syndrome is a lethal condition, but it is unusual. Now talking about the large PR interval means greater than 200 milliseconds. Large PR intervals, they can indicate the first degree atrioventricular block, means there is a slowdown of impulses through the AV node. First degree atrioventricular block is not a serious condition, but second degree and third degree atrioventricular block can be medical concern. Now after PR segment with the QRS complex, the normal time interval of the QRS complex is between 60 milliseconds to 120 milliseconds, and the maximum amplitude of the QRS complex on the ECG graph is 2.5 to 3.0 millivolt. Then talking about the abnormalities in the QRS waves. Moving on to the first abnormality, that is when the time interval increases or the QRS complex widens. So when this QRS complex will widen, this can widen if there is a delay of the electrical impulses for the depolarization of the ventricles. Why this delay will occur? This will occur due to LBBB, means left bundle branch block, or RBBB, means right bundle branch block, causing the delay of the electrical impulses to cause depolarization of ventricles. Second condition, that is increase in the amplitude of the QRS complex. That can be due to enlargement of the ventricle, hypertrophy of the ventricles, or the dilatation of the ventricles. Second condition, that is a decrease in the amplitude of the QRS complex. That can be due to pericardial effusion in the heart. One point that I've skipped here, that is this QRS complex may also widen in condition of severe hyperkalemia or in overdose of tricyclic antidepressant medications. Fourth, J point. It is a point where the QRS complex ends and the ST segment starts. It is here. So the elevation of the J segment can be a normal variation, but it can be related to pathological condition, that is hypercalcemia or hypothermia. After J point, ST segment. ST segment represents the time interval when the ventricles are contracting. ST segment on the normal ECG graph is isoelectric or a flat line. But if there is an elevation or depression in the ST segment, that may indicate certain pathological condition. Now talking about the ST segment elevation. ST segment elevation may denote three conditions, that is myocardial infarction, pericarditis, or Brugada syndrome. Myocardial infarction is also known as heart attack. It is a condition when there is abnormal supply or loss of supply to the heart vessels or coronary artery. Second condition is pericarditis, which means filling of fluid in the pericardium layer of the heart. Third condition is Brugada syndrome. It is a genetic condition. This condition has no cure. This condition is responsible for 8% sudden cardiac deaths. So what actually happened in this syndrome? The gene which encodes sodium channel is actually defective. We know sodium and potassium are helpful in the depolarization and the repolarization waves in the whole body. It can be nervous system, cardiac system, etc. Next, talking about the ST depression. Here, in case of myocardial infarction, ST depression or elevation can be there. Next, with the left ventricular hypertrophy. If there is an hypertrophy or increased muscle mass or thickening of the walls of ventricles, that can result in the ST depression. And third is digoxin overdose. Digoxin is a drug that is used to treat different heart conditions like atrial fibrillation, flutter, or heart failure, etc. T wave. T wave comes after the ST segment. The upward slope of the T wave is gentle and its downward slope is more steeper. The T wave looks asymmetrical normally. This can be a differentiating factor between the T and P wave. P wave looks more symmetrical. Now with the abnormalities in the T wave. Usually the T wave amplitude diminishes with age and its normal amplitude is less than 5 mm in the limb leads. Abnormalities which the P wave indicates by its inversion or by its elevation. If there is an elevation of the P wave greater than 5 mm in the lymph node, it may indicate hyperkalemia. And if there is an inversion of T wave, that may indicate myocardium ischemia or infarction, left ventricle hypertrophy, metabolic acidosis or disturbances, and high intracranial pressure. Now at the end with the U wave, which comes after the T wave. The U wave is more prominent in V2 and V4 leads, which are also known as chest leads or the precordial leads. The more prominence of the U wave may also be indicative of hypercalcemia, hyperkalemia, or hyperthyroidism.